Do you sometimes have pain in your knee during running or walking? Or are you looking at increasing your activity and want to prevent future injuries? So if you answered yes to one of these questions, tune in to learn more. Hi, my name is Angela from Miami/Lakeland's Physiotherapy, and I'm here to talk more about dynamic knee valgus. So basically it's a sideways angle of your knee and how it increases risk of injuries during running or sports. So what is dynamic knee valgus? It is a knee position that looks like the knock knee. It is a position that we can be genetically more predisposed to. That is how your bones are made up and how you stand. But sometimes your knee position is normal at rest, and when you move, your knees go into that knock knee position. This is called the dynamic knee valgus, and it is caused by the lack of strength and control from your hip and knee muscles. So research has shown that increased dynamic knee valgus increases your risk of ACL injuries and other lower leg injuries. It also puts more load onto your lower limb joint, which has the potential to cause patellofemoral pain and joint pain due to excessive loading. So one of the easiest way to identify if you have decreased motor control is doing your squats or sit to stand. When you are trying to stand up from sitting, look at your knee position. For some people, you can start seeing your knees go inwards, causing that knock knee look. This test can also be done when you're doing a squat. So if you're someone who runs, who plays competitive sports, however, it is not enough to only not have increased knee valgus when doing sit to stand or double leg squats. We need to be able to have good knee control when doing single leg squats and single leg jumps. So if you have tried this test and you can see that you have that bit of dynamic knee valgus, or you've had previous ACL injuries or discomfort in your knees, come through to Miami Physio for a thorough checkup and a personalized rehab plan. Keep reading to learn how to start your journey to achieving better knee control. So there is no one-size-fits-all exercise when it comes to motor control training, really. It is important to figure out your level of activity and the demand of your sports and life, basically, to determine the level of knee control you need to achieve. After that, we would start to determine a good starting point by seeing what exercise is the best fit. It needs to be challenging enough but not too hard at the same time. If you notice that your knee knocks inwards when you're doing a sit to stand, start doing exercise by doing a sit to stand while keeping your knee in line with your hip and foot. So this also applies if you have trouble with double leg squatting or even single leg squatting. The best exercise are the exercises that are functional and relevant to you. So the exercise needs to be progressed with time, and as we progress, we gradually get closer to your goal. It is highly recommendable that you work with a professional for motor control training, and as it is challenging to find a perfect regime by yourself. So visit us at the Miami or Lakeland's Physiotherapy Clinic for a thorough assessment and a personalized rehab program.